studio Dr. David Persse representing the city of Houston, and soon to join us will be Dr. Umair Shah representing Harris County. This is sponsored by the Rotary Club of Houston, and we are happy to say that past president of the Rotary Club of Houston, Kathy Finninger, is in the studio with us. And so welcome, Kathy, and we appreciate your support. We're going to jump right in and put Dr. David Persse on the spot here. If a child is sent home because of COVID-type symptoms but tests negative, should the school ask the student to stay home for 10 days or ask the pediatrician to make the decision? Some pediatricians are very reluctant to weigh in since the test may be a false negative.
Yeah, it is a difficult question. So certainly, you know, at this point, if the child has symptoms, fever, cough, whatever, I mean, they need to be sent home, obviously, whether it's COVID or not, because even and as we enter into the viral season, the crux of your question is they need to stay home for 10 days. And since we're talking about a virus that if it spreads throughout the school and those kids bring it home to their parents and their grandparents is potentially deadly, I would err on the side of caution. And I would say the kids should stay home for the 10 days. Now, if you go and you get a test that's positive, that makes it easy, but there are false negatives with some tests, particularly if the child is having minimal symptoms. And so, you know, if it were my child, I'd bite the bullet. I'd keep my kid at home for 10 days because I don't want to be the parent who's responsible for spreading the virus throughout the classroom and then having somebody go home and create a tragedy.
Absolutely. So what you're saying is let's err on the side of caution.
I would err on the side of caution.
And you're really basing that on the fact that the child is symptomatic.
That's right. That's right. You know, the other problem we're going to have is that with kids in particular, and there's no defense against this, is that a lot of these kids are going to be infected and have minimal or no symptoms.
Okay. Impact. Have you heard anything about how local colleges are doing with transmission?
So I've not gotten any reports from our local colleges yet. We are seeing the reports in the media about some outbreaks in colleges across the United States, but so far, knock on wood, you had to ask the question. We'll probably get the phone call this afternoon. Thank you very much. But we've not heard anything locally from our local colleges yet.
Yeah, nationally, I know, of course, I saw the numbers coming out of University of Alabama, Notre Dame, and actually saw an article where University of Arizona was able to divert an outbreak because they were doing wastewater testing in some of the dormitories.
Yep.
Another one of your favorite questions. The positivity rate declined from 28% to 7.8%, and we have no statewide travel restrictions. Texas is not welcome in certain states, so must quarantine. How much more improvement is needed before we can visit other states without restrictions?
Yeah, that's a great question. I think that's a question to the receiving state and or country. But the standard that most folks are going by right now, and this comes from the WHO, and quite honestly, you know, they kind of pulled it out of the air, is 5% or less for 14 days. And so I think once Houston gets there, and I do believe that we will get there, I'm keeping my fingers crossed, so we got to keep our foot on the brake. But once we get there, I'm believing that other communities will start accepting Texans like they did before.
But ultimately, the decision is up to
it's still up to the other state or the other country.
Yeah. You know, I hear where some states are very restrictive. I was talking to a friend, I think she's from Rhode Island, and had to make a trip to Maryland. And she said she had to be back in Rhode Island within 24 hours, otherwise she would have had to quarantine for 14 days.
Wow.
That's pretty restrictive. I don't even know how to monitor that.
Yeah, I was wondering myself how they enforce that. They have at the state line. I don't have no idea.
Who knows? UK neurologists published a warning of serious brain disorders in people with mild COVID symptoms. They mentioned in 1918 flu, where people may have developed brain disease. Is that accurate?
Well, there's two parts to that question. So the part about 1918, I don't know. I'm not that familiar with what happened in 1918. But in terms of this virus, it is true that we are seeing that there are people that are having both short-term but you know, we're hoping not long-term effects on multiple organ systems, including the heart. There was an article that was out showed that somewhere in the neighborhood of 20% of folks who were hospitalized with COVID, when they evaluated them with MRIs afterwards, there was scar tissue had developed within the heart in nearly 20% of the patients. And there are a lot of people that are talking about this brain fog and short-term memory issues and so on and so forth, long after having recovered from the COVID-19 illness. And so the thing is that what we believe the pathology is that this virus likes many different organ systems, unlike other viruses that tend to like one. But the one organ system this virus seems to like is the lining of the blood vessels, which of course goes everywhere. And so if you get inflammation of that lining of the blood vessels, slows down the blood supply to the organ, you're going to have problems.
And so what you're saying is the effects of COVID will be with us for a long time?
I'm afraid so, yeah.
your thoughts. Doctors in Australia have mentioned invertamectin, the wonder drug that makes coronavirus easy to cure even after one dose. It's considered one of the safest meds from Japan, where it originated. They have also recommended adding zinc and doxycycline as a preventive every 2 weeks.
Yeah.
Are you familiar with that?
I'm a little bit familiar with it. So there are actually two drugs that are getting attention right now. One is a antiparasitic. I think that's the one that we're talking about, is the antiparasitic. And it has shown some early promise, but it hasn't gone through the randomized control studies. And so in the one study, it showed that within 24 hours, the cells were unable to replicate the virus. So we have more to come on that, but this is very exciting.
Okay, thank you for joining us on our COVID-19 talk with local health authorities. We'll be right back with Dr. David Persse and soon to join us, Dr. Umair Shah. Thank you.
With coronavirus spreading, people at higher risk must take extra precautions. You are at higher risk if you're over 65, or if you have an underlying medical condition like heart disease, chronic lung disease, diabetes, or if your immune system is compromised for any reason. If you're at higher risk, stay 6 feet or 2 arm lengths away from others. Better yet, stay home if you can. The choices you make are critical. Please visit coronavirus.gov for more information.
Learn to cough and sneeze with your pal Grover. Step 1. Realize you're about to sneeze. Step 2. Move your elbow toward your nose and mouth. Step 3. Gesundheit. 1, 2, 3. Remember to cough and sneeze into your arm or elbow and not your hands.
Welcome back to our COVID-19 talk with local health authorities. And Dr. Shah, welcome. David took the first 8 minutes.
That's perfect. I love it.
You're welcome. Okay, the last question was really related to treating COVID. And off camera, we were having this conversation about steroids, because I know they've been used. You said it was old news. So can we kind of put the use of steroids in perspective as it relates to COVID?
Yeah. So I'll start. So the early on with COVID, so first of all, generally with viral illnesses, there's a little bit of trepidation about using steroids with viral illnesses because it has a history of sometimes making things worse. And so in the beginning, when folks were being treated with steroids, there was cases where it appeared to be making things worse. So doctors peeled back from that quite a bit. And then the research, and this is a good soundbite for about, you need to do the research the proper way in order to get the real answer. They found that actually steroids can be beneficial, but it had a lot to do with the timing and how sick the patient was. And so now the use of steroids has been used. And I think that the new news is that some more prospective randomized controlled, well-done studies have come out to reinforce that used properly, steroids can be very beneficial.
And used later in a more ill population is the way that I've been reading with the steroids, but your perspectives on that as well. Because in other words, COVID-19, don't go out, I test positive, let me now go get steroids. That's not the message. The message is that really talk through with your physician, and it's mostly in the healthcare setting when you're hospitalized or if somebody is really ill before you actually would engage in steroids.
So I shouldn't go out and take steroids just because.
For a number of reasons, that's right.
But I want to pump up. Okay, Dr. Tim Reed, an ophthalmologist professor at Texas Tech, says selenium inactivates the virus. Yes or no?
So that,
I don't.
if it's the one I'm thinking of, there was a new drug that came out that that they infected cells. And I think that's the drug. That's why I'm going to give this answer. And that within 24 hours, the cells were no longer able to replicate the virus. The problem is that was in a petri dish.
Okay.
And so while that's very encouraging, now making the transition generally first to animals and then to humans, there's a whole lot of variables there. But for a single dose to stop, then the cells were unable to replicate the virus within 24 hours on one dose. So that's very encouraging, but that's a long ways from.
So we shouldn't go out and buy selenium.
I would not. Yeah.
That's right. But you should.
Oh wait, selenium.
Yeah.
All right, so that's the.
Right. Yeah.
Okay.
So
that's not what I.
Yeah.
I thought you were talking about a different drug. Sorry.
Yeah, so I mean, when we're always thinking about miracle supplements and vitamins, there are no miracle supplements and vitamins, but we do know that taking multivitamins and certain supplements can be, in general, good for your health, but you have to make sure that the right ones and the right manufacturer of those vitamins and supplements is absolutely critical.
Yeah.
But none of them have shown really in any massive way to be able to curtail COVID-19.
You're right.
Okay, Julie Gerberdine, who was director of CDC, said we should fund public health like national. Dr. Fauci said we undershot our preparedness. What in retrospect should we have done locally? I guess that's bias for us, right, in terms of funding for public health.
Well, it is, but the funding for public health over decades, the last 40 years, has dropped off dramatically. And a lot of that is because no good deed goes unpunished, right? So we've done a great job, particularly with the use of vaccines and water and food surety and reducing air pollution, and we've made tremendous advances in protecting the public from a public health standpoint, to the point where the funding has been curtailed. So that then when something like this pops up, we no longer have the infrastructure that we had in the 50s and 60s.
Yeah, I always think of it as we're the offensive line of the football team. So everybody knows Deshaun Watson, and everybody knows the quarterback, healthcare system, doctors, nurses, the bells and whistles, and we're the offensive line. And so, you may know the quarterback, but who's number 75 on the Texans, right? And that's us. And the difference is that in football, at least if a team wants to be successful, is that if you have a great season or a great game and the quarterback doesn't get sacked, you continue to invest in that offensive line. But in public health, we do the opposite. Tuberculosis rates go down, measles rates go down. Oh, we don't need public health anymore. And you defund it, you stop investing in the offensive line, and then you start to have issues. And then people say, well, you can just catch up. But the problem is you can't catch up because there aren't epidemiologists that are just sitting on the side of the road waiting for them to be plucked up by a health department. You have to build infrastructure. You have to keep that infrastructure. And so I think that's the challenge across the globe, really, not even the country, about public health and just the underappreciation of our field.
Certainly, I agree, Umair. I was an offensive lineman, so I guess that's why I'm in public health, right?
I played defense, so
you have to be really smart too to be an offensive line.
I was in on one sack my whole time, so that was my one moment on Friday Night Lights.
In addition to a raging pandemic, what is the deal, and this is for you, Umair, with releasing a genetically altered mosquito? It appears Harris County Public Health hasn't given the okay, and that certainly sounds wise. Are we going to release genetically altered mosquitoes?
Well, it's interesting because we had been in discussions with a company called Oxytec previously that had these GMO, genetically modified mosquitoes that they had been looking at. Essentially what they were doing was making the genetic modification renders that mosquito as it mates with other mosquitoes, the offspring are unable to continue to propagate the species, if you will. So what they did is they went to Florida, and Florida, they're looking at releasing those, and I believe that was what the FDA gave an approval for that, and eventually it was FDA to EPA and gave an approval for Florida. But in that press release, it said something about, and it's going to be coming to Harris County next. And that is still, I'm going to put the slowdown on that one because we have not re-engaged that conversation. And so in the midst of a COVID pandemic, that's not the direction we're going right now.
Okay.
So the answer is no.
Okay.
I don't
What
like
is the
mosquitoes.
use about convalescent?
And Dr. Persse does not like mosquitoes, so there you go. That's another
Nobody
reason.
likes mosquitoes. Spray them or stay inside.
I mean, we are looking for ways to have strategies that are novel, but we have to be very careful about it. So we're going to watch what Florida does with this.
Okay. What is the issue about convalescent plasma? FDA issued an emergency use authorization, but I thought this was already being used. What does plasma do and do not for the patient?
You want to take
Do
that?
not do for the patient.
I'll let you.
I'll let you take because I don't.
Come on, hurry up.
Well, you know, I think the truth is that convalescent plasma has been used previously for treatment purposes, and this is essentially somebody who's already been infected, recovered, and then you use that as essentially passive antibodies, and you go ahead and give it to an individual who's sick now, and then you can have an ability for that individual to recover. So what the FDA was doing with this EUA was that there was some additional fast tracking that they were doing about some of that therapy and that convalescent therapy, and they were the controversy that came up with how they went about looking at what the approval process was and who they were going to be approving. So that's the key that sort of got into this whole uproar that's had with the FDA of late. But I think in general, the convalescent plasma has been an effective therapy. The question is, how do you go about doing that, which company and what kind of products it is, and that's the basis of the controversy.
Is it true that the mask order is in effect until 14 days after the governor declares there is no longer public health disaster? What goal would that require? Let's talk about masks in general. Is it likely that we're going to be wearing masks for a while?
I think we're going to be wearing masks for a while. Yeah,
Yes.
long while.
Yeah, long while. The Judge Hidalgo's mask order, instead of having to see it expire, in fact, it was about to expire right at the day that Hurricane Laura went the other way. And so, you know, it just reminded us that instead of having to extend it, you know, every 2 weeks or every 3 weeks or what have you, it is now tied with the governor's declaration. So as the governor's declaration of expires at the state level, 14 days beyond that is when that mask order will expire. That way it doesn't have to continue to be
But the bottom
reviewed.
line here is that even with the potential vaccine, even if the numbers go down, we should probably still engage in some level of distancing.
Right.
and-
So the
and wearing-
conundrum in your comment that people need to understand is that if the rates go down and things greatly improve, this is pre-vaccine, right, and things get much better, it's going to be because of the masks and the social distancing and everything else. So that it's counterintuitive to stop wearing masks when everything gets better because it's just going to get bad again.
Right.
Okay, thank you for joining us for COVID-19 Talk with local health authorities. We'll be right back.
Wash, washy, wash, washy, wash your hands. Scrub them while you sing the song. Wash, washy, wash, washy, wash. Rub your hands and fingers and the places in between. Using soap and water makes your hands so clean. Wash your hands. Great job, you're almost done. 5, 4, 3, 2, 1, now dry.
Wash your hands for 20 seconds, just like Elmo.
There are everyday actions to help prevent the spread of respiratory diseases. Wash your hands. Avoid close contact with people who are sick. Avoid touching your eyes, nose, and mouth. Stay home when you are sick. Cover your cough or sneeze. Clean and disinfect frequently touched objects with household cleaning spray. For more information, visit cdc.gov/COVID-19. This message brought to you by the National Association of Broadcasters and this station.
Respond to the upcoming 2020 Census survey online, by phone, or by mail. A complete count of all Houstonians helps our city secure federal dollars for roads, schools, healthcare, housing, and disaster recovery. By answering just 9 questions, your voice will help shape how Houston is represented by state and federal officials over the next 10 years. The census is easy and everyone counts. Your responses are safe and confidential. For more information, please visit 2020census.gov.
You have to stay home.
Not just to protect yourself, but to protect others.
Stay at least 6 feet away from other people. 2, arm's length. Just because you're at home
doesn't mean that we can't be alone together.
Have questions about the coronavirus?
I'm here to share some simple steps you can take to help protect yourself and others.
Avoid touching your eyes, nose, and mouth. Wash your hands often with soap and water for 20+ seconds.
Cover your cough or sneeze with a tissue.
Clean and disinfect surfaces and objects. Wash hands after touching commonly used items.
Together, we can help slow the spread.
Welcome back to the COVID-19 talk with local health authorities. We have quite a few questions, actually 2 weeks worth of questions that we have to get through. Some states do not require school districts to report COVID cases. What is the requirement in Texas?
In Texas, the school are supposed to report it.
Yeah, they're supposed to report it to the state. We're trying to make sure that they also remember to report it to local health departments as well.
I've heard July 22nd was the peak date in Texas. Does this mean it's on the down curve now?
Well, our trends are looking in the right direction. It looks like if that was the peak, it's definitely going down. What we don't want to have is we rebound and go and have another peak.
This question is about testing. No, we don't know how many people have been tested multiple times, but how often should realistically we be tested?
2 ways of answering that. One is periodically if you've been exposed, obviously, and if you have symptoms, definitely you want to get tested more. But I don't know if you have any.
So I mean, so the incubation period is 14 days. So in a perfect world, people would be getting tested once every 2 week period, right? That's probably not realistic. So I think if people would make an effort to get tested monthly, that's probably realistic and achievable.
Where can I go to easily locate testing sites for the day? I find this confusing.
Well, we both have websites.
Yeah, we have some. The state has a website that's got the information. Harris County, readyharris.org has information. I'm sure the city has information.
Yeah, Houston Emergency.
If you go to state, county, city, governmental health websites, you should be able to find it.
Okay. If you're asymptomatic for 10 days, are you still contagious?
So the belief is that if, provided you're not somebody with a chronic illness that impairs your immune system, so for most healthy people, if 10 days past your first day of symptoms, you should no longer be infectious to someone. But if you've got immune-compromising illnesses, or if you're on immune-compromising medications like chemotherapy and stuff, it's 20 days.
It's 20 days. Okay. Yeah. Is the pandemic increasing opioid addiction?
Yes.
It is?
We've seen
Tell us about it.
So when you look at April, May, and June of last year versus this year, we've seen a nearly 20% increase in 911 calls for opioid overdoses.
Wow.
So yeah, it's significantly up. And we're just assuming it's due to all the extra stressors on people's lives. Yeah.
And the isolation to some extent.
Sure.
Yeah, the mental health piece of this and substance abuse is all driving in the wrong direction.
The CD says asymptomatic people may not need to get tested if they have been in close contact with infected persons. I hear many quoting this thought. Others say if we follow CDC guidance on testing, the pandemic will worsen. That was a controversy that occurred last week, right?
Yeah. I'll just come out because I've been really adamant about this, and so is Dr. Persse. The CDC is wrong on this. I mean, if we have been saying asymptomatic, 40 to 45% of people can be asymptomatic and can still spread. And we've also been saying that if you have been exposed to somebody with COVID-19, you should get tested. So absolutely we want people to get tested. So I have to, unfortunately, I have incredible colleagues at CDC, we all do, but they're wrong on this one.
Yeah, I agree.
We do not agree with that, right?
That's right.
No, we do not.
Bottom line, what will move us from red to orange?
That's yours.
Well, numbers going better direction. I mean, we're going the direction we have to sustain them for a period of time, depending on which of the metrics, 7 days, 14 days. But the other thing is that it's ICU numbers, the positivity rate, total number of cases in the community, and then certainly just making sure that we've got our transmission numbers lower.
And up until this week, they were all moving in the right direction. Now we've seen a little bit of wobble with the hospitalization numbers.
And we have Labor Day coming up, and that's another concern.
Do not take your foot off the brake.
That's right, yeah.
Y'all are analogies. University of Hong Kong researchers say that a reinfection of a 33-year-old was less serious than his first infection, and that seemed to indicate you can get a separate strain. Have there been any other cases? Should those who have recovered get periodic tests?
So yeah, there have been a couple of cases. I think we've got 4 in the United States. Is that right? So there have been 4 cases of people who apparently had clearly cleared the illness and then became reinfected. So yeah, you can get reinfected.
And it's too early to tell about whether it's a different strain or what's going on with that, but that is a concern for all of us.
How would a widespread use of plasma change the current treatment options for the virus?
The plasma is for people who are sick and hospitalized, right? And you know, it's not 100% effective, right? It's very effective, but it's not 100% effective. So right now they're using it on folks who are, and there's two parts to that equation. They're using the folks who are sick enough to need it, but also need to have enough available. So as people who are cleared of the illness have the antibodies, if they go and donate blood, or go to the blood center, and they donate the plasma, then the hospitals have more to use. I don't know where we are in the balance on that right now, but we may be drawing on folks for help.
I've heard BMI of 30 plus makes up susceptible. Why?
Well, we are seeing that comorbidity with obesity is a significant driver in the complications from COVID-19, and maybe there's something about the transmission related to that. We don't know exactly, but there are some additional factors that not everybody who's obese obviously has heart or other kinds of complications, but a lot of people do. So you have other underlying health conditions like hypertension and heart disease or diabetes.
Renal disease.
There's a lot that goes, that's right.
This is a related question. Obesity is a major factor. Why? And the answer is there are probably other coexisting.
That's right.
Well, and then there's another thing, I don't know if it's theory or not, but I was reading that, so part of the virus gets into your cells through the ACE2 receptor, and people who are obese apparently have more ACE2 receptors.
Okay.
Yeah. Now, and I'm thinking that's,
See, I learned something new from Dr.
Well, I read that, I don't hang your hat on it, but
late at night.
my point is that I think it's more than just all the things you use are absolutely true. I think there's also something at the cellular level as well. Yeah.
Can COVID mutate, and if so, has it?
Yes and yes.
Please discuss vaping issues related to COVID.
Well, vaping's bad.
Well, we know that COVID obviously takes effect with the microvasculature, including in the lungs, and vaping also has a similar effect in the lungs, and so that's a double effect. We want people to avoid both COVID and also avoid vaping. And whether there's a summative cumulative effect, we don't know.
Okay, my jury duty was postponed, and I was wondering how the courts will keep us safe when they reopen on October 1. Answer to that's probably distancing and masks, right?
Yeah.
Distancing, masks, and obviously some of the screening coming in.
And we can't control the virus with present treatments. Is it practical to continue with major economic shutdowns?
You know, look, we're hoping, none of us want us to go back to a point where you have to shut things down. We're hoping that we don't ever have to go back to that place, and that's why it's going to continue to be up to all of us.
Okay, the last question. Governments are not using common sense. State and county boundaries are artificial, and we've seen stories about restaurants on different sides of the street with one being open and the other not. What can we do to encourage logic? That's,
I'll tell you one thing. Here's the answer to all these questions is we as a community it's our collective responsibility to slow down and stop this virus. Wear the masks, wash your hands, social distance. The numbers will all go down. The economy will open up. Just do it.
So basically use common sense, right?
Yeah.
That's right. Including and especially over Labor Day weekend.
Because we're tired.
Yeah, and there's stop looking for the shortcut, do the job.
That's
Do
right.
the job,
That's right.
mask, distancing, good hygiene.
And stay out of large gatherings. Stay out of gatherings at all if you can.
Thank you for joining us for our COVID-19 talk with local health authorities. Dr. David Persse, representing the City of Houston. Dr. Umair Shah, representing Harris County. I want to thank you to past president of the Houston Rotary Club, Kathy Finninger, who is in the studio with us. And I'm Stephen Williams, the director of the Houston Health Department.